Delaware.
Mr. President, I rise today to join my colleagues in raising the alarm about the possible impact for all of us in America, and in particular for my constituents in my small home state of Delaware. Should we indeed, as a body, proceed with barreling forward and repealing the Affordable Care Act without a plan to replace it, as seems to be the intention of the majority? When I was first elected to the United States Senate back in 2010, the Affordable Care Act wasn't even a year old. Yet Republicans were already trying to repeal it without offering any comprehensive plan with which to replace it. Now, more than 6 years and 60 repeal attempts later, it's truly disheartening to see that when it comes to plans for the American healthcare system, seemingly nothing has changed. Instead of working across the aisle to find constructive fixes to this Affordable Care Act that could win bipartisan support, instead of finding new ways to invest in infrastructure or strengthen American manufacturing, or coming together to respond to the Russian attack on American democracy, or even waiting a week to take this upcoming vote so that we senators can give our full focus to vetting the president-elect's cabinet nominees, instead of pursuing any of these priorities, it seems we're once again spending, even wasting, the American people's time to fulfill a misguided and, in my view, mean-spirited promise to repeal the Affordable Care Act at all costs without a clear plan to replace it. Sadly, in that sense, nothing has changed since I first came here in 2010. Not so for the American people, though plenty has changed for them and for my home state of Delaware. More than 20 million Americans now have gained access to high-quality health insurance across our whole country, including 38,000 more Delawareans. Now, 38,000 is not a big number of people, but in my little state of 900,000, 38,000 more people who couldn't get access to health insurance before and can now is a big deal. Across the whole country, the rate of uninsured Americans is at a record low of just 11%, and in Delaware, fewer than 8%, and this is well down below pre-ACA levels. But let me focus on what I think is the biggest, broadest, and most important benefit of the Affordable Care Act. Not just those tens of thousands in my state who've gotten coverage on the exchanges, but in my little state of 900,000, 560,000 Delawareans get their health insurance through their employer, as the vast majority of Americans do. And for those 500,000 or more Delawareans, they've gained lifetime improvements to the quality of the health insurance they have through the ACA. No discrimination against pre-existing conditions. Young people can stay on their parents' health insurance till they turn 26. Free preventive care. No lifetime limits on coverage and recovery. And a requirement that insurance companies spend 80 cents of every dollar on health care versus overhead. These 5 key consumer protections have been the center of the best of what the Affordable Care Act has delivered to Delawareans and Americans. And Americans no longer have to make the phone calls they used to their senators, their congressmen, their local representatives, pleading that they could somehow find access to quality and affordable coverage. These reforms have made a real and tangible impact on Americans across the country. But I've also come to this floor, Mr. President, on a number of occasions over many years and recognized the challenges of the Affordable Care Act, the ways in my home state that it has fallen short of our hopes and goals when it was initially passed, and have offered with an open hand to work across the aisle to find vehicles to repair and improve elements of it that haven't worked as had been hoped. Before I turn to that, though, let us focus for a few minutes on hearing the stories of Delawareans who've reached out to me. Because at the end of the day, my passionate defense of the Affordable Care Act is rooted in individuals I've met and heard from, people whose lives have been changed by access to quality, affordable, accessible health care. And as Republicans move us forward to a repeal vote, it is my hope that they will listen to these and other stories and think about what possible alternative pathway there might be that would save the opportunity for them to have access to decent, quality health care. I grew up in a tiny town, a town of about 1,500, called Hockessin, Delaware. And Nicole is also from Hockessin and reached out to me to tell me her 2-year-old daughter has cystic fibrosis. And Nicole spends at least an hour every day administering her daughter's breathing treatments, and at $5,000 a month. Her medications aren't cheap. And Nicole is confident that without the Affordable Care Act, she would have exceeded her annual cap on medical expenses well before the end of each year. Nicole makes it pretty clear to me that without the consumer protections put in place by so-called Obamacare, the ACA, she would have had one of three choices. Choices tragically faced by many Delawareans and Americans before the Affordable Care Act. One, hope she somehow qualifies for Medicaid, which she probably doesn't because she's hardworking enough and successful enough that her income makes her ineligible for Medicaid. Option two, go into deep debt to pay for her daughter's needed and life-saving treatment. Option three, stop giving her daughter some of the medications she depends on and just hope and pray that she will not suffer needlessly. And that's all assuming her daughter's cystic fibrosis wasn't considered a pre-existing condition, preventing her from getting any insurance at all. Let me review that, Mr. President, because Nicole's story starkly outlines the new reality that millions of Americans could face if we continue barreling down this misguided path of repealing the Affordable Care Act wholesale without coming together around a plan for replacement. So that reality for so many sick Americans or Americans with sick children is this. First, hope you don't get sick. If that fails and you don't qualify for some other form of government assistance, either go into debt or try to get by without health care. That's it. That's what it was before the Affordable Care Act, and following its repeal, that may sadly be what it is again. Over the last few weeks, Mr. President, I've heard many, many other stories. I'll cover a few quickly if I could. Kim from Wilmington, Delaware, is a thyroid cancer survivor who's able to get insurance because her cancer is no longer considered a pre-existing condition. Will her ability to access affordable, quality health care be repealed? There's Sue from Frankfort, Delaware, whose husband got sick a decade ago, desperately sick, and hasn't been able to work since. They're retired, but not quite eligible for Medicare. Yet despite his illness, they've been able to find coverage now on the individual market. Will repeal of the Affordable Care Act deny Sue and her husband access to quality health insurance? There's Carla from Odessa, Delaware, whose son was able to stay on her health insurance when his employer didn't cover him. Not only that, but Carla's sister, a self-employed gardener with a 40-year history of insulin-dependent diabetes, also known as a pre-existing condition, was able to get health insurance when she tragically divorced at age 63 and lost coverage through her husband's employer. There's Matthew from Wilmington, whose son was diagnosed with brain cancer. The year before his son's diagnosis, Matthew and his family were on a non-ACA compliant health insurance plan. And as Matthew wrote me, quote, "Our family was young and healthy and we thought this plan was right for us. Then my 11-year-old got sick right out of the blue. It can happen to anyone at any time." Mr. President, Matthew is right. Illness can strike any one of us anytime, and not just the flu, not just a cold, but tragic, expensive, terminal illnesses can strike any family in America at any time. Just listen to the story of Carrie from Wilmington, Delaware, a massage therapist who considers the Affordable Care Act, as she puts it, quote, "nothing short of miraculous." Here's why. Carrie signed up for health insurance in 2014, thanks to the subsidies, the tax credits provided through the Affordable Care Act. She had long had nagging abdominal and lower back pain, but didn't think much of it considering she had no family history of terrible diseases and had never even had a stitch before. Fast forward to January of 2015, when a routine diagnostic procedure covered by her new health insurance revealed that Carrie had stage 3 colon cancer. She had surgery a week later, followed by 6 months of chemotherapy, and ended up facing no out-of-pocket expenses besides her annual deductible. Carrie's cancer has now been in remission since September of 2015. And as she writes, quote, "The ACA came along at the last possible moment to save my life. I'm certain that without it, I would have just continued to live and work with the discomfort and try to self-treat until my cancer was so advanced it could not have been successfully treated. Mr. President, I have many more, but stories like Carrie's and Matthew's, Carla's, Sue's, and Kim's have been pouring into the inboxes of my colleagues from states around the country. Yet my Democratic colleagues and I know and have known since the day it was signed into law that the ACA is not perfect. I've talked to small businesses that want to offer health insurance for their employees, but have struggled to find affordable options in Delaware. I've met plenty of Delawareans whose deductibles or premiums are higher than they'd like to see. And I've heard from economists and budget forecasters who know our country's fiscal health depends on doing even more to control health care costs. That's exactly why 2 years ago I came to this floor with a simple common sense request of my Republican colleagues. Work with us to make the Affordable Care Act better. And a colleague, a physician from the state of Louisiana, happened to be listening that day, and we've had a number of constructive and positive conversations since. But sadly, despite many attempts over many years, I so far have been unable to find a Republican partner willing to actually co-sponsor meaningful, constructive fixes to the law. In my view, and as I said 2 years ago, no conversation about the Affordable Care Act and how to improve it can be complete without reconciling the reality of the millions of Americans it has helped and the many others for whom it has fallen short. I've sought to address the affordability of health care coverage for all families, co-sponsored bills to increase tax credits to make it more affordable for small business, look for ways to make sure there's more competition in the marketplace, especially in small states like Delaware, and pursued common sense regulatory reforms and cost containment efforts to further slow the growth in health care costs. For years, my colleagues and I have asked our Republican friends to put aside the rhetoric and focus on pursuing bipartisan fixes like these. Today, the bottom line is still this. The Affordable Care Act, I know, has helped millions of Americans, just like the Delawareans whose stories I've read. Carrie and Carla, Matthew, Sue, and Kim today live healthier, safer, and more secure lives. Let's take a look at the alternative. There is no single proposed plan. There are dozens of bills in the House and Senate that would do lots of different things. But it would be very hard to predict with precision what the alternative really is. But we know what repeal will do. As of today, the alternative, let's call it Trump Care, is nothing more than a wholesale repeal with no clear plan to replace. Trump Care, a simple repeal, by one estimate, would kick 26 million Americans, more than 50,000 Delawareans, off their health insurance. Even for those who don't lose their insurance, those hundreds of thousands of Delawareans who get their insurance through their employer, it would be much lower quality because it would remove all the consumer protections that we've all come to embrace. It would give a nearly $350 billion tax cut to the wealthiest 1% of our country and a nearly $250 billion tax cut to big corporations. And while tax cuts have their day and their reasons, pushing aside all of that revenue with no plan for how to replace the Affordable Care Act and how to pay for it, I think will become a desperate and dangerous move. Trump Care, a simple repeal of the Affordable Care Act would cut 3 million jobs and trigger negative economic impacts well beyond the healthcare sector by creating profound uncertainty. And last, it would burden state and local governments, which would lose nearly $50 billion in tax revenue. That's the reality. And describing a repeal of the Affordable Care Act as anything other than the injection of wild uncertainty into our daily lives, into the health insurance and healthcare markets, is just not square. That's the reality. Describing it any other way is political rhetoric. And that, sadly, is what this debate currently is about, is repeal without replace. Matthew from Wilmington, whose 11-year-old son was diagnosed unexpectedly with brain cancer, concluded his note to me with one last thought. He wrote of his son, quote, "He's my hero, and I will fight for him, and all others who continue to suffer similarly every day." Thank you, Matthew. Thank you for sharing your story and continuing the fight. And I promise to you and all the Delawareans who've reached out to me to do my level best to stand with you and fight for you every step of the way, every day, until we find a better path together. Thank you, Mr. President. With that, I yield the floor.
Mr. President.